This is Dr. Roger Knapp, pediatrician. I'd like to talk about ear infections, real common in pediatrics, and definitely we see quite a few every day. Ear infections can start even in infancy, but actually the newborn is born totally in water inside the mother's womb. There's no air in there, so when they're born they have to cough, sputter, and put air in their lungs and get that water out of there. And we also have to yawn and pop open their ears. So every newborn has fluid in their ears and is actually a setup for an ear infection. And there's occasion we do see an ear infection in that first month or two of life. And the mother is startled by that, but not too uncommon. But it's not caused by anything they do. Ear infections are not caused by water in the ears or wind or hats. Now there is swimmer's ear, but that's in the older kids, school age, who are spending half their time swimming underneath water. But the average ear infection, that's an inner ear infection, it's caused by a congestion, stuffy runny nose. They can't yawn and pop open their ears, if you know what I'm saying. And the fluid builds up in the inner ear via the eustachian tube, and then the bacteria get in there and get it infected. This is a common problem, especially in the winter. Expect 3 or 4 ear infections the first winter, 1 or 2 the second winter, and none the third winter. I hate to use the word grow out of it, but as their immune system gets better and their muscles' ability to yawn and pop open their ears gets better, then later on we won't see much of you. And it's typically more seasonal, fall, winter, occasionally spring. And to quickly put in PE tubes in their ears because they've had 1 or 2 ear infections, probably not a good idea. There's always risk to anesthesia, and the PE tube that's put in there puts a scar on the eardrum. And when we looked at long-term studies, the kids who got tubes and those who didn't, the hearing was about the same. It's not going to damage their hearing, and there's a slight decrease no matter whether we put tubes in or not. And most kids are not affected at all in their speech and language by the fluid that's in there. There's a rare one that is, but in most cases it's not. Think about you and I when we've had congestion, stopped up ears, and you couldn't yawn and pop them open. You still could hear, but it's just muffled a little bit. So most kids who have a lot of ear troubles, they're talking okay. It's just that we have some kids with ear problems and some kids with speech problems, and we tend to blame it on that when in fact most studies show there's not a big correlation. But trust me, there's a lot of debate on this, and I'm sure I'm startling a bunch of people out there saying that I'm wrong. But I've been doing this a long time, and there's many kids who are not affected at all as far as affecting their speech and language and stuff. And that's another different video on language. So what we'd like to do is treat the ear infections when they come up, 10 days of antibiotics. We don't want to overdo antibiotics, so the recommendation now is if they are acting normal, feeling fine, and after 10 days of antibiotics, to not re-examine the ears and maybe give more antibiotics because it might be a little pink. If there's a little residual infection in there and they're asymptomatic, we just assume their own immunity get rid of it and not overdo antibiotics. So we've kind of stopped dragging them into our office after 10 days, although there's still some people who do that. The trend is to not see them because we're not going to treat it. They should be feeling better after 2 days of antibiotics though. So if by the 3rd day they're still crying or fever and got green noses and not sleeping, then you need to let your physician know and maybe change antibiotics to a different one. All the antibiotics will do the job, just this germ is resistant to that one and this one to this one. If it's a failure of that antibiotic, they never get better. Now once we treat the 10 days of antibiotics, 1-2 days off the antibiotics and it's like you never took it. The germ that comes along doesn't care if you're on antibiotics 2 days ago or 2 years ago. So if you give 10 days of antibiotics, literally the next week or the next month, or hopefully not a year, for a year, they can still get another ear infection. and giving a lot of antibiotics will not weaken their immune system. I have another video on that subject. The ear infections are usually going to cause pain or fever. So what you're looking for is the child waking up in the night crying, or obviously fever. We want to see them. And teething doesn't cause fever. So the child who might be pulling on their ears, but they're happy, eating, sleeping, feeling fine, that's not an ear infection. An ear infection causes pain or fever. Now sometimes I do see a child in a well exam, and maybe he's rubbing his ear, and I'll look in there and it's just a hint pink, it's not that bad. And the child's sleeping and not running fevers, eating, feeling otherwise okay. I tell the parents, let's just give it a few days and see if this doesn't go on away and not overdo antibiotics. And many times it goes away on its own. And so don't be concerned you might be missing an ear infection, because if it's that mild, we just assume their own immunity to take care of it. If the child's up screaming or running fever, of course, then call your physician. I've seen some ear infections in the older kids, and again, some of these will go away on their own. So a lot of times in the older kids with their better immune system, what I'll do is say, well, let me send you out some antibiotics to the computers of the pharmacy, but hang on and don't go get it, and let's give it a day or two and see if it doesn't go away on its own. And if they continue to be symptomatic, then I'll go pick up the prescription that's out there for you. So there's different ways we can handle this, and that's kind of my approach. I hope that helps you in some of the symptoms. Thank you. This is Dr. Roger Knapp.